I think everyone has some intrinsic creativity within themselves, and being successful as an art therapy client does not depend on artistic talent at all. We have two very exciting projects going at my university, and both of them were started by my students' ideas. It is working with veterans who have post-traumatic stress disorder that is associated with their combat experience. And in the VA hospital, the treatment of choice, or the treatment as usual, is called cognitive processing therapy. That's a verbal kind of therapy.
Okay, very thought-based, I'm
yes.
guessing, right? Cognitive,
it
we're going to
involves
talk about it.
multiple individual sessions, homework, writing, things of that nature. So what we've done thus far is we have about 30 people who have completed this project. Half of them do the cognitive therapy, the other half have cognitive therapy plus art therapy. And our initial results are really very exciting for art therapy.
What are they pointing to?
Well, they're pointing to the fact that the participants in this study stay with the therapy longer. They don't drop out. They do better on a couple of our measures. We've been looking at their PTSD symptoms. We've also been looking at depression, which is very associated with PTSD.
That makes sense.
And on both of those measures, the individuals in the art therapy or experimental group have made much greater gains than the ones who are involved only in the verbal therapy. These individuals are excited about art therapy and felt that it was really beneficial to them, that seeing portrayals of their own trauma that they have drawn themselves has been very, very helpful to them in terms of thinking through and processing that trauma and consigning it to the past. So it isn't always present with them in the form of flashbacks or anxiety attacks or things of that nature.
You're seeing the improvement in kind of concrete symptoms that we can check off on a checklist.
Yes, exactly.
But you're also getting firsthand from the people who are facing these challenges, just their descriptions, if I understand correctly, where they're saying, I think this has been really helpful to me.
Yes.
Oh, that's really great. And a lot of times I think research is very numbers focused because numbers help us grasp these big concepts, but how exciting to be able to have that extra human element, if I can use that term, where they say.
Sure. I think that's, as an art therapist, I think that's really important.
Right.
A very important aspect of research is getting the opinions of the people who are actually undergoing the intervention.
As you kind of look at where you are now in this research and the populations and the work that you've done, what keeps you energized to keep doing this work? You've had, you know, an illustrious career. You've been a president of the association, you've published, you've presented, you've taught. What keeps you still engaged? What keeps you coming back?
Well, I think there's a critical need for research in art therapy. Employers and large entities like the VA are looking for evidence-based practice. So any kind of support that we get for the work that we do in the form of research, that's hard data for employers and large organizations to look at and say, well, you know, here's something that really works, so I'm going to hire art therapists. You know, that's one thing. And there's so much, it also informs our practice, which means that the public that we serve is getting the best quality service delivery if it's based on research. So.
Well, I thank you for sitting with me and for doing the research you're doing, because we've just, you know, shown how it can help so many. So thank you.
You're welcome. Thanks.